With 160,000 new COVID cases per day in the US, the pandemic is far from over. SARS-CoV-2 variants are the latest concern. What do these variants mean for the course of the pandemic? This video summarizes what we currently know about the variants, vaccine efficacy, and staying safe. When viruses enter host cells and make copies of their genome, they inevitably introduce errors called mutations. SARS-CoV-2 has a spell checker, but it is not perfect, so it ends up with one or more mutations every now and then that get passed on to new copies of the virus. Most mutations are either harmful to the virus and cause its elimination or are relatively neutral. However, a small proportion of mutations could be beneficial to the virus, and the mutated virus will spread better than the original virus. The World Health Organization classifies variants that we need to care about into variants of interest, variants of concern, and variants of high consequence. Variants of interest have changes that could be beneficial to the virus, but they require further study. Scientists are keeping an eye on them. When a variant of interest is clearly making an impact, could be making people sicker, evading vaccines or treatments, or is more contagious, then it becomes a variant of concern. There are currently no variants of high consequence of the SARS-CoV-2 virus. There are currently 4 variants of concern, and they've been given easy-to-pronounce, non-stigmatizing names from the Greek alphabet. The earliest documented samples of the Alpha variant were from the UK in September 2020. For Beta, it was South Africa in May 2020. Both were designated as variants of concern in December. Gamma was in Brazil in November and Delta in India in October. These variants have descendant lineages, and scientists use a combination of letters and numbers for nomenclature. The Delta Plus differs from Delta by only one mutation, so it did not get a Greek letter of its own. The current variants of interest are Eta, Iota, Kappa, Lambda, and Mu. They have all been designated as variants of interest in 2021. Now let's talk about the Delta variant that now accounts for 99% of COVID cases in the US. Why should we be concerned? First, in attaching to cells, Delta is like super glue. It has accumulated mutations in the spike protein, which forms these projections on the surface of the virus, and these have made it much more effective at sticking to cells and gaining entry. Second, the viral load is 1,000 times higher. The viral load is how much viral particles are detected in the back of the throats of infected patients. Viral loads are 1,000 times higher with the Delta variant than with previous versions of the virus. Third is the high R0 of the virus. R0 is the basic reproductive number, which is the number of people that an infected person is expected to transmit the virus to. The earlier versions of the virus had an R0 of about 2.5. For Delta, the R0 is between 5 and 9. Fourth, the number of COVID cases among young people is increasing. Nearly 1 in 4 new COVID cases now are in children. That's over 26%. In the week ending September 6th, an average of 369 children were hospitalized every day because of COVID. It is important to know that since the beginning of the pandemic until June 2021, almost half of the hospitalized children had no known pre-existing conditions. The American Academy of Pediatrics warned against long-term complications in pediatric COVID patients and recommended that children who tested positive have at least one follow-up exam with a pediatrician for residual problems including respiratory symptoms, heart problems, and cognitive issues. So are vaccines effective? Yes, they are. Then why are there breakthrough infections? It is important to know that these vaccines were studied for their efficacy against severe disease and death and not infection. So a vaccinated person can still get infected, but is much less likely to get severe symptoms and die. Data from the World Health Organization suggests that the Moderna, Oxford AstraZeneca, and Sinovac vaccines, among others, are 80% effective against severe disease and death. How about vaccine efficacy against variants? We don't have that much data, but so far it seems that the vaccines are still effective. A study published in July in the New England Journal of Medicine showed that 2 doses of either the Pfizer or AstraZeneca vaccines are effective against the Delta variant, just a little less effective than they were against the original virus. The CDC released data comparing vaccinated and unvaccinated individuals infected with the Delta variant. Vaccinated individuals were 8-fold less likely to develop symptoms. For hospitalization, it was 25-fold, and death 25-fold. A study from Singapore looked at the viral loads of vaccinated and unvaccinated people infected with the Delta variant. During the first week of infection, the 2 groups had similar viral loads, but viral loads quickly dropped in the vaccinated individuals after day 7. It is important to know that viruses can only mutate if they keep infecting people. If we compare an unvaccinated population with a vaccinated population, the virus keeps mutating in the unvaccinated population because it has free access to host cells with little or no resistance. As long as the number of vaccinated individuals is not high enough, the virus will keep circulating and will have ample time to accumulate mutations, some of which could be very problematic. It is in our power to prevent this scenario from happening. First, we need to get as many people vaccinated as possible. Second, it is important to continue to wear masks, wash your hands, and avoid large gatherings in accordance with local health guidance. Thanks for watching and stay safe.